Under Taifa Care, we have introduced a comprehensive benefits package. Once the transition from NHIF is complete and SHIF becomes fully operational, Kenya will have a healthcare system that guarantees dignity, peace of mind, and equitable access for every citizen for the very first time in our 60 years of independence.
And now it's not Shifsha,
it's Taifa Care.
It's now Taifa Care.
Yeah.
Jamila.
Yvonne, Taifa Care, as the president referred to it today, why did SHIF or SHA or Taifa Care, as he's calling it, why was it supposed to have replaced NHIF according to the government? Because it's supposed to provide better health services, broader access, and greater efficiency. But Yvonne, this whole SHIF rollout has been very rocky. Because remember, even in the beginning, before its rollout, there were pleas for more time to fine-tune the systems. There was the postponement of the rollout date twice. There was last-minute leadership changes. And then there was an enabling of this scheme that had been in operation for nearly 60 decades. This is the NHIF. Looking at it that way, those were red flags about SHIF. Kusabili harakishwa. There were a lot of T's that had not been crossed, a lot of I's that had not been dotted. Its rollout initially was set for April. That didn't happen. It was pushed to July 1st. Then again, there was postponement to October 1st because there are challenges to the digital platform, of course, which raised a lot of questions why we need a whole new one. We could have just used the other one. This was going to cost us over 100 billion shillings. But even by the time the government was rolling it out on October 1st, there are structures that had not been put in place, including the login system. People are unable to log into the system. To date, they're unable to log in the system. Patients were turned away after the rollout. Unasema niko na valid NHIF card, you're told we're not using it anymore. You have to start paying out of pocket. The primary health care bit of it. There are a lot of questions about why did we change what was already working? Why couldn't we do it gradually? But then even we've had the government, through the president himself, CSs, government officials, really trying to, in my opinion, shove this down people's throats. There were a lot of teething problems. They were not minor, they were major. The whole dialysis issue was a big one. People were unable to get the services that they'd been getting for a while because they had to be told to pay out of pocket. But still, we're insisting on that. I don't know if the challenges that were raised are being addressed, because even as late as early as yesterday, there were complaints about the SHIF rollout in some places in this country. But the president in his speech today still talks about it and talks about how the transition will be successful, how for the first time in 6 years of independence, they'll have peace of mind and equitable access to healthcare for every citizen. But that is not really being seen with the rollout, with the SHIF as it is now, or with Taifa Care as it is now, because watu bado wanateseka wanahangaika Yvonne. And if this thing was working, if the rollout was, okay, not as smooth as they would have hoped to be, we would have seen it. Because your lazima ipigiwe kelele isemo it's doing well. We would see it. But we're not seeing, even if we are, there are very few cases of it working anywhere. We don't go out looking for places where people wanasema iko mbaya. Because the places where it's not working are so many more than the places where it's actually working. So Yvonne, I think it's important that the government, I think, takes a step back and takes stock of how SHIF Taifa Care has been since its rollout on October 1st, and actually be honest with themselves and say, I think there are very huge gaps here that need to be looked at and be sorted out, because the intention may have been good, but reality kwa ground ni mbaya sana. Yeah, and that was one aspect of the State of the Nation. Sam, what was it that stood out for you?
Connecting to what she was just speaking, you know, today is 21st of November 2024, and this is the very last day that NHIF should have existed in this country.
Yeah, transition is tomorrow.
Exactly, because the Social Health Insurance Act provided for 1 year from the effective date, and the appointed date, which was 22nd of November 2023. So the year expires today. So tomorrow we should not hear that, because the law provides in the transitional clause that notwithstanding whatever has happened up there, which I've not read. The National Health Insurance Fund Board shall wind up the fund within 1 year from the appointed day, and the cash balances and all other assets shall be transferred to the authority. Now, here we are. Tomorrow, nobody calling themselves that I work for NHIF should actually be working for the Social Health Authority if you are to follow the law strictly. But even as we are sitting here, there is no member of staff under the Social Health Authority apart from the members of the board and probably the gentleman who was appointed to be the acting CEO of SHA after Elijah was sent on compulsory leave. So still so much work yet to be done for the Social Health Authority. And of course, the other thing that I would want to mention that really, looking at the state of the nation, when the president was speaking about state of education, and he acknowledged the challenges that universities have been facing, saying that when he came to the office, 23 out of 40 public universities were on the verge of closing because they were almost insolvent and they were facing challenges. Now, of course, he's brought on board the new university funding model, but look at it, where are we now? It has actually been stopped by the courts. I felt that was not acknowledged by the president, that actually there are challenges even with the lecturer strike. I'm not sure I had it. I could have missed it, but I didn't hear anything mentioned by the president about the lecturer strike, which is now on day 23 of the second phase in this calendar year. And you find that learners have been stranded, not able to go to school for two reasons. First, they don't know how much money they're supposed to be paying because the university funding model has been stopped by the courts, and they have been told that they should not be implementing it. Universities do not have resources. They are having challenges to offer services. The lecturers themselves are not in school, so no learning is going on there. There are students who are supposed to be graduating in the next few days or weeks in the month of November and December. That may not happen, especially for those that have been affected. They have not sat their final examinations. So this particular one was not addressed. The other part is about the competency-based curriculum. The president spoke about that when he came on board, there was confusion about transition. Indeed, there was transition, and action was taken to make sure that the junior secondary schools are domiciled in the primary schools instead of secondary schools. But there are serious challenges going on there because now you have grade 7 and 8 in school. They have deficiency of teachers that are supposed to be training them. Majority of the teachers are teaching them on humanities. Not sufficient numbers on sciences, no laboratories for them. They have not been exposed enough for them to be making decisions because come January 2025, they'll be joining grade 9, which is the final level before joining senior secondary school. And they're supposed to be accessing laboratories. They're supposed to be accessing libraries. They're supposed to be accessing teaching, training, proper training on sciences for them to make a decision. Do I want to pursue science? Do I want to pursue humanities? Do I want to pursue sports science? So that, I feel, was not addressed. The president is saying that 20,000 more teachers will be hired in January. But who are these teachers?
Yeah, where are they coming?
I mean, you don't just populate institutions with numbers, because numbers are okay. We can be 3 here, but what are our specializations? What are we supposed to be offering if you're to teach in this class? What are we supposed to be teaching?
Yeah, so from health and education, for me, it was interesting because this is his first State of the Nation following the June and July protests that we saw in this country. I want us to listen to what he had to say on extrajudicial killings and actions in this country.
A good number of alleged disappearances have also turned out to be arrests made by police officers. In such cases, the suspects have been duly arraigned in court. I must, however, make it very clear, I condemn any excessive or extrajudicial action which puts the life and liberty of any person at risk, including disappearances and threats to life. I urge all Kenyans with information about such cases to forward the information to the Directorate of Criminal Investigation and to IPOA, where they suspect members of the police service to be implicated.
So that was him speaking about that, and he actually talked about the digital age that and I'm paraphrasing here, that we live in which it can be used to inform, to entertain, but it can also be used as a channel of misinformation. He talked about finding the distinction between protesters and criminal elements, between police and rogues, between democracy, freedom of speech, and misinformation. And he condemned the excesses and asked anyone with information to go to the authorities. But, you know, he also said that some of the disappearances that have been reported have turned out to be fake. Some of the abductions that have turned out to be arrests. And still, you find the executive on one end saying this thing, and, you know, the Kenya Human Rights and Commission and many others listing the number of people who remain missing, people who have been killed. It was interesting because, you know, there's many people whose loved ones are still missing, and to hear that some of the disappearances may have been fake, you know, it's so much has happened, and I think the country has significantly changed in certain aspects since June, July. But, you know, we are still here with the same narrative. I mean, I think there was nothing new. Perhaps would have wanted to hear a little bit more. And of course, while this was being said, there were protesters outside who were arrested, perhaps not abducted, as he would say that some of the abductions turned out to be arrests. So that was an interesting thing to say, I think, regarding that. Perhaps there would have been more to hear from him, you know, since that time, because those events of June and July forced him to sack, you know, a good part of his cabinet, bring back others, do lots of reform, at least at that level. So some denials and some acceptances and some admissions. That is what I found interesting. And you see, with all of that and the arrests happening outside Parliament for those who wanted to protest the state of the nation, and it just takes you back to then what the clergy had been saying when they were giving perhaps their sort of state of the nation, their reflections on where we were, and what a week that has been from last week. I mean, I wasn't here, and you were dealing with the Catholic Church. And how many statements that came?
There were 4.
No, in response.
Oh, there were 5.
Oh, there were several. There were several.
I think about almost 15, yes.
We also heard of speeches.
People on X and everywhere in response to that. But then this week, what happens, you know, even as perhaps proverbially the Catholic Church is, you know, taking hit after hit, the Anglican Church.
Yes, I think maybe we can listen to them talking about calling for national prayer to call all corrupt people into account. That was